Welcome, everyone. My name is Rachel Massey, and I'm the Senior Science and Policy Advisor with CHE, the Collaborative for Health and Environment. Please feel free to introduce yourself in the chat if you'd like to. I'm going to start with some quick housekeeping items. CHE is a member group of the EDC Strategies Partnership, which is bringing you today's webinar. The partnership members include Healthy Environment and Endocrine Disruptor Strategies, or HEEDS, a program of environmental health sciences, Commonweal's Biomonitoring Resource Center, and the Health and Environment Alliance, or HEAL. We'll disable the chat during the presentation, but please type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentation. If you'd like to activate closed captions, you can do that by clicking the button on the bottom of your screen. This webinar is being recorded, and it's scheduled to last for 45 minutes. If you'd like to download today's slides, you can find them on the webinar page on our website at healthandenvironment.org, and we'll put that direct link into the chat in just a moment. Today's moderator is Charles Patton, Director of the Biomonitoring Resource Center. Charles, over to you.
Great privilege to introduce today's speaker. I'm very excited about this, as are we all. Dr. Trisandi is an internationally renowned leader in children's environmental health. His research focuses on identifying the role of environmental exposures in childhood obesity and cardiovascular risks, and documenting the economic cost for policymakers for failing to prevent diseases of environmental origin in children proactively. Perhaps best known for a series of studies published in Lancet Diabetes and Endocrinology and the Journal of Clinical Endocrinology and Metabolism that document disease costs due to endocrine-disrupting chemicals in the US and Europe of $340 billion and 163 million pounds annually, respectively. Today, we're going to talk about his work at EDC Chemicals and Plastics. This is especially important today because the UN Plastics Treaty is entering into its fourth Intergovernmental Negotiating Committee, INC, next week, and will be followed by the fifth INC in the fall. Our hopes this treaty will develop an internationally legally binding treaty on plastic pollution and will address the issue of toxic chemicals used in the production of plastics. The disease burden directly attributable to plastic production and consumption is substantial and runs across the entire lifespan. Okay, Dr. Trisandi, I'm going to turn this over to you.
Thank you, Cheryl, for it's such a warm presentation. I'm assuming my slides are appearing on your screen. Is that correct? Great. Okay, it's an honor and joy to be with you here today. We're going to start at a introductory level for about endocrine disrupting chemicals, recognizing that many of you have heard various speakers who've presented about this work as well, but we'll get very quickly up to the connection between plastics and endocrine disrupting chemicals. And unfortunately, what little we know is that these all ultimately originate in petrochemicals via oil and gas in their origin story. And the fossil fuels industries are clearly seeing plastics as an off-ramp for the fossil fuels where they can't burn it. They want to make plastic from it. And that has consequences for human health that will magnify, particularly in low and middle income countries, if the treaty does not limit the exponential growth in plastic production and consumption. So I'm going to jump right in here. These are my top line points today. So many of the additives, especially used in plastics, are known to interfere with hormone functioning and thereby are by definition are endocrine disrupting chemicals. There is clear and extensive evidence of the human health effects of many chemicals in common. And here's where I'm going to not editorialize. I'm just not going to use slides to describe some of the science here. So much of the attention in the media and in the general public has been on microplastics and nanoplastics. But nanoplastics and microplastics are a lot like the nanotechnology that is increasingly saving rare cancers and conditions that used to be untreatable before. Where the two are comparable is one is a drug delivery system for the benefit of humankind. But What we're dealing with when we're dealing with microplastics and nanoplastics are the breakdown products in many cases of polymers that carry residues and are exquisitely effective at delivering toxic chemicals to cells and organ systems, with consequences that, as Cheryl described, run from cradle to grave. I'm going to provide some overview of some of those consequences. And the health and economic impacts of chemicals used in plastic materials are profound and extremely large. So we need a global plastics treaty that A, reduces plastic production, recognizes hazards posed by recycling and the use of bioplastics, uses hazard rather than risk to evaluate and remove EDCs from plastics. We need expanded biomonitoring globally. And finally, we'll talk about a need for an independent scientific body to evaluate hazards, particularly for EDCs, which unfortunately the Venn diagram overlaps quite well with plastics. So I'm just going to start with some basic definition. Endocrine disrupting chemical is referring to the endocrine system, our hormones, which are signaling molecules that underlie basic biological functions from temperature, metabolism, salt, sugar, and even sex. When you're talking about endocrine disrupting chemicals, yes, there are natural chemicals that do disrupt hormonal function, but what we're talking about here today are, in this definition, are synthetic chemicals that either mimic endocrine function or themselves hack the molecular signaling through multiple mechanisms, be it epigenetic or other non-direct binding of the hormone. We know of 1,000 synthetic chemicals, but there's so many more. We don't test enough for the effects of endocrine on the endocrine system in particular. And part of that is that the complexity is much more than testosterone, estrogen, thyroid. It's much broader than that. And on the right, you see a list of the most well-known endocrine disrupting chemicals, and they run across a bunch of functions underlying a variety of consumer products and many economic activities. So these are widely used chemicals in society. We're all functionally exposed to endocrine disrupting chemicals. So just moving along to the next slide from there. Oh, excuse me, this my clicker seemed to get a little frenetic there for a moment. If there's one thing I can impart upon you is that the impacts of chemicals used in plastics, and particularly due to their endocrine disruption, are mainstream science. This is not science that disputes whether there are effects. It's how many and when and how. The Endocrine Society raised the first alarm in 2009 with the first Endocrine Society scientific statement. This was mostly an animal laboratory series of findings that prompted the report. It was soon followed by the World Health Organization and United Nations Environment Program that flagged in 2012 that EDCs were a global public health threat, emphasis on each of those words. And that led to a lot of consternation and controversy by the chemical industry. So at the UN's meeting for chemicals policy, called the Strategic Alliance for International Chemicals Management, there was a lot of discussion. The WHO UNEP report was welcomed. I had the privilege of attending that meeting. And on the right, you see a second scientific statement, not published long thereafter, by the Endocrine Society, with 1,331 scientific references, particularly with human evidence, matching the footprint in laboratory and animal studies. So you have a rapidly, exponentially accelerating base of evidence on which to mount that documents the effects of chemicals on the endocrine system, with effects that run from cradle to grave. We're talking about prematurity, low birth weight, childhood obesity. We're talking about a variety of cancers that occurred at different phases of life, from testicular to breast to prostate. We're talking also about cardiovascular disease, ultimately. And we're talking about infertility, as well as a variety of effects on sexual and reproductive function. Again, the evidence is more widely recognized than even when I first made this slide. The International Federation of Gynecology and Obstetrics has patient-facing guidance. My American Academy of Pediatrics documented particular emphasis on chemicals used intentionally or unintentionally in food packaging and other food contact mechanisms. The World Obesity Federation documents the need for policy change, particularly linked to reducing endocrine-disrupting chemical exposure as a means to combat the obesity and diabetes twin pandemics we're facing. And then most recently, the National Academy of Sciences documents the need for clinical testing, routine clinical testing in high exposure scenarios and scenarios where there are conditions linked to nonstick chemical exposures. And those nonstick chemical exposures might not appear on the surface to be plastic related, but when we're thinking about that nonstick cooking pan, that is a plastic coating that is protecting the metal from touching the food ultimately and transmitting the heat in a more even way. It's plastic. And that's really, if I can impart another takeaway here at a very early point, it's that what you think is plastic is much smaller than it actually is. It's much more pervasive than we originally realized. So just to draw some emphasis on this point, I've already alluded to the reality that nanoplastics and microplastics are the most visible threat when it comes to plastics, but they're more likely to be mediating their effects by transmitting endocrine disrupting chemicals that are along for the ride. We have monomers like bisphenols used in polycarbonate plastics and aluminum can linings. We're talking about phthalates, which are additives to soften food packaging and make it more pliable for use. We're talking about those PFAS that I've alluded to. We're talking about brominated and increasingly organophosphorus flame-based flame retardants that are additives to reduce flammability. And I would be remiss if I didn't emphasize the reality that if you burn plastics, which is one of the pathways to not recycle, but as the end product of plastic production and its life cycle, you create dioxins, which if you release them into the environment, you have possibly the most potent carcinogen known to humankind. So just to talk a little bit about bisphenols, they're prototype obesogens. They make fat cells bigger. They disrupt the function of estrogen, which can have sex-specific effects on body mass and can disrupt the function of adiponectin, a protein that protects the heart. In this audience, I probably don't need to emphasize the reality that we are constantly replacing one problem with another with plastic chemicals. This slide is slightly out of date. There are actually 140 bisphenols. What little we know about bisphenol S, the prototype replacement for bisphenol A, those BPA-free bottles that you've described may have BPS in them. They're as estrogenic, as toxic to embryos, and as persistent in the environment. So we're whacking them all. What we know about phthalates is that they antagonize androgen or testosterone in the case of ones that are used for cosmetics and lotions. In particular, the ones that are used in softer food packaging are known to disrupt the expression of genes that are crucial for lipid and carbohydrate metabolism called PPAR, or peroxisome proliferation activated receptors. Most recently, and I think this is under-recognized as a phenomenon, we built on a large trove now of studies that document the effects of phthalates on prematurity. Phthalates probably act in a couple of different modes by disrupting placental function. They contribute to inflammation that's been well recognized in addition to oxidative stress. And sex hormones are crucial for the maintenance of the placenta and the prolongation of birth to a point where the baby can be the healthiest out of the womb possible and the most contributive to society. So I happened to actually be at a meeting for NIH for the program that provided this data, the Environmental Influences on Child Health Outcomes program. It's the U.S. National Children's Study. Some of you may remember a time where that was a thing. It was put into place by a Children's Health Act in 2000. The idea is to have a national database looking at environmental influences on child health outcomes. And what we found here across 5,000 mother-child dyads were consistent associations, not just of the older phthalates that are widely detected in the US population still, di-2-ethyl hexyl phthalate, a softener of food packaging. But again, the replacements were more impactful than DEHP itself. We're talking about diisodecyl, di-N-octyl, and diisononyl at the very least, that were in our models most strongly associated with decreases in gestational length, as well as increases in birth weight. And the reason why, even in the normal range of gestational age, that matters is every week provides an additional opportunity for development that can't be imitated outside the womb. What we know about prematurity is that it has two sets of major endpoints. First of all, a premature baby is more likely to need medical care and is more likely to endure longer-term consequences. And those longer-term consequences include cognitive deficits. So we pay immediately as a society in terms of direct medical care. And we also pay in terms of each IQ point being roughly worth 2% less economic productivity of that child over her or his lifespan. So what we did here first in this paper was not just to stop at the data from 5,000 US births. What we did was to take nationally representative data from the Centers for Disease Control and Prevention called NHANES, the National Health and Nutrition Examination Survey, to take exposure data as we understood it to occur in 2018 and applied that exposure data using our associations in the ECHO models. And on the back end, then calculating what that would mean if these findings were consistent across the US population, which, because ECHO is largely representative of the United States, is likely to be the case. And what we found here was an estimated 50,000, as many as 20,000, as low as 120,000, you can see here. We're talking about 5 to 10% of US premature births that can be traced to phthalate exposure in utero, with social costs in the range of $4 billion. Most of that is long-term cognitive deficits and in lower economic productivity, but there are also direct costs for additional medical care, treatments, respiratory therapy, and what have you. So this is a major, and this is again an annual cost. There'll be a theme throughout the presentation. So far as exposures continue at current levels, we're going to accrue cost to society. The plastics industry is profiting off of chemicals that hurt children and ultimately cost us as a society. And this was recently published in Lancet Planetary Health. But that's not the only impact. That's early life exposure. What little we know about adult exposure is that we, frankly, are all vulnerable. It's just what the vulnerability manifests as. Again, that inflammation in arteries doesn't just affect the placenta, which is a major network of blood vessels that feed the baby, but the inflammation enters the coronary arteries. And in particular, in adult men where low testosterone is a marker for and predictor of adult cardiovascular disease, it could well be that men are especially vulnerable to cardiovascular disease, but we're all vulnerable because of that inflammation directly in the coronary arteries. And what we found in a study in 2021, using data from the National Health and Nutrition Examination Survey, again, linked to the National Death Registry in the US, was an increase in mortality up to 10 years later in relationship to phthalate exposure. And particularly when we looked at the subset of mortality, it was the cardiovascular mortality. It wasn't the cancer mortality that was contributing to this. And that's 50,000 deaths a year. And again, because adults dying in their peak earning years is costly to society, that's a $23 billion loss in economic productivity. And unfortunately, phthalates are not the whole history here, the whole story here. We know that bisphenols narrow coronary arteries, narrow coronary arteries, but they also narrow arteries that feed the brain and potentially could be contributing to stroke. They reduce heart rate variability. Heart rate variability is an early harbinger of adult cardiovascular disease and mortality. And in a previous study, we had actually shown effects of bisphenol A using that same data set I referenced on heart rate variability, on all-cause mortality and cardiovascular mortality. And let's not forget that bisphenols are obesogens and contribute to diabetes, as described in the data on the right from a large French case cohort study, in which they not only found bisphenol A, but bisphenol S associated with incident diabetes. We know that PFAS are also important chemicals used in plastic and contributors to disease and disability across the lifespan. What little we know is that it reduces birth weight and also contributes to childhood obesity. But again, adults are vulnerable too. PFAS in multiple independent observations have been identified as contributing to weight gain and diabetes. And in one study based at a group at the Harvard School of Public Health, they found that the reason why the PFAS were increasing obesity, mind you, in people who had lost weight through healthy diet and physical activity. So this is independent of the usual factors you think of. It's not just calories in, calories out. There was a decrease in the resting metabolic rate that explained the association here. So we have, again, a drumbeat of science consistently documenting through multiple mechanisms, frankly, that PFAS not only are obesogens, but contributing to diabetes. And then I would be remiss if I didn't emphasize the very strong literature linking brominated flame retardants to decrements in IQ through disrupting thyroid hormone. The baby relies on thyroid hormone through the second trimester, through mid-second trimester. And if you disrupt even in the clinically normal range thyroid hormone due to brominated flame retardant exposure, you can have cognitive deficits as well as clinically significant autism and attention deficit hyperactivity disorder. And what we know is that 4 US largely, but also European-based cohorts have shown consistent exposure-response relationships between PBD exposure measured in mothers and IQ in the babies born to them. So this is, again, another cost to society of plastic chemical exposure. In this case, a flame retardant added for many years to polyurethane plastics, especially in furniture, but in other plastics as well. I would also be remiss if I didn't, and I'm only going to provide a glancing mention to this, of the fact that endocrine disrupting chemicals are more known to disrupt male fertility, but we haven't looked well enough for their impacts on female fertility. We know most about Shauna Swan and others' work looking at phthalate exposure and decreases in anogenital distance, which is a marker for sex hormone balance and linked directly to adult, ultimately decreases in sperm count as well as cardiovascular disease. But we also know that bisphenols are potently toxic to the ovarian function and system. So there are likely effects on both sexes when we think about fertility as an endpoint. Now I'm able to provide the broader context in which we started to cost out the consequences, first to EDCs and then to plastics. So some of you who contributed to this work may well be on this phone call. We put together expert panels where we looked at the evidence for EDC contribution. We used rigorous evidence using the GRADE working group and WHO criteria for evaluating the epidemiologic evidence, and also applied the Danish EPA's criteria for evaluating the toxicological evidence. We brought that together to come up with probability of causation using the Intergovernmental Panel on Climate Change approach. And what we found here, first in Europe and then in the United States, was substantial disease contribution due to EDCs, 160 billion euro a year, 1.2% of the gross domestic product of Europe. And as we'll talk about, most of this ends up being due to plastics. But I want to emphasize, this is all underestimation. We only looked at fewer than 5% of EDCs, a subset of diseases due to the few chemicals we studied, and a subset of costs due to the few diseases due to the few chemicals we studied. So this is a severe underestimate of all the total costs that might be in play. Now, I want to make a point here that policy is really crucial. The costs in Europe are much higher for pesticides and much lower than flame retardants than what we did subsequently in the US. And that's all policy driven. We required, no offense, due to a California law that required the addition of flame retardants to furniture, such that in the United States, we had 10-fold levels of flame retardants compared to our European colleagues where they banned them much earlier. And the converse is true for pesticides because of the Food Quality Protection Act that required an additional safety factor and thereby reduced exposures that children were put through as a result. So the costs are higher in the US, $340 billion a year. That's because of flame retardants, 2.3% of the gross domestic product. But there are some good policy stories. And I think that really supports what we're talking about in the needs for a global plastics treaty to protect disease and save money to society. We have published work looking at 13 endpoints for PFAS and found $5 to $63 billion of costs in the US across 13 conditions. This is where I get a chance to actually provide some low and middle income country data, which suggests severe and substantial contribution of PFAS to low birth weight, which is not included in global burden of disease calculations, mind you. And the disproportionate impact is in Asian countries where the exposure appears to be the highest. Now, let me get to the punchline. And the reason I had to lead up to all of this is all of those data fed into the analysis that I'm going to talk about here today. What we did was to isolate the percentage of the disease burden and costs in previous papers on that percentage that was due to plastic production and consumption. And you can see on the left hash of the slide that the percentages are extremely high. These were based on often industry data, if not government and other independently verified scientific data that identified and were able to tease out the proportion of chemicals with regard to their use in plastic as opposed to other non-plastic uses of the chemical. So we excluded all the non-plastic uses of the chemical and then summed up the disease burden and costs that were left over. And you can see for phthalates, it's 98%. For butyl phthalates and benzyl phthalates, it's a particular subtype, it was nearly 100%. For flame retardants, it was 98%. For PFAS, it was 93%. And when you add all those up, you get a $250 billion cost, updated to 2018 estimates, of US disease burden due to plastic chemicals. And what's great about this analysis, in my opinion, is that we also were able to sort out which particular chemicals were driving the cost. So yes, the majority is PBDE exposure, but a fourth of it was due to phthalate exposure. Another 1/10 of it was due to PFAS exposure. And so insofar as policies reduce different types of chemicals used in plastic, you'll see changes over time, hopefully downward, because hopefully the exposures will be reduced by the policy measures that lead to reduction in disease and disability due to those individual chemicals. So from a tracking perspective, this sets the stage for being able to look at US costs and hopefully global costs as well. So I'm going to now close with some of the steps that are really needed, and I'm going to focus on some specifics of plastics and consequences in the policy space. I've already emphasized this at the top, but we need to reduce plastic production. That's our only way to reduce the cost that I've described. Recycling is a fig leaf of consumerism and has all sorts of flaws with respect to the ability to reduce chemical exposures. And bioplastics are also a flawed solution in this space. We fundamentally need to get out of, all I've presented to you is based on risk. Risk incorporates exposure. But the reason we're in a situation where we have such large risks is that we have not been able to manage the reality that hazard, that is, that data already showed us problems at a very early phase that did not regard exposure. We waited too long to really act to reduce exposure. So a hazard system that does not regard exposure is really the only solution that will be viable in preventing future generations of disease. We need global biomonitoring, and we need an independent body to evaluate EDCs going forward. So I'm going to address these points one by one. Perhaps in this audience, I don't have to emphasize that 9% of plastics have been recycled, but leaving aside the feasibility issues and the fact that many companies are not truly at 30%, or they're using some very interesting sleight of hand to model their recycling percentages. The fact is, recycled polyethylene has been identified to have bisphenols, phthalates, and metals higher than virgin plastics. The fact is that when you treat plastics with whatever mechanical or other mechanisms to facilitate the use going forward of that plastic material, the fact is you're bringing along chemicals for the ride and potentially enhancing, if not just carrying forward the same amount of chemical exposures from the previous life cycle of a plastic material. Bioplastics are, I understand, a very exciting alternative, but they're largely underdeveloped as a technology. And right now, the feasibility just is not there. You need high temperatures, so you're going to drive climate change problems through the roof. And you also have known oxidative stress and anti-androgenicity from chemicals used in bioplastic bottles. I've already emphasized this previously, and just to beat a horse, if you will, or whatever analogy you'd like to use, we will always be behind because we can't extrapolate from animal or cell experiments or whatever to human low-dose exposures with respect, and that's with respect to potential consequences for risk, because things don't obey straight lines. There's a lag from exposure to outcome that's substantial in many cases. And we assume we can magically identify the degree of vulnerability based on age, and that's just not true. Adults are as vulnerable to EDCs as kids. That doesn't mean I would suggest a one safety factor for kids, but it does raise serious concerns that our modeling of risk is fundamentally problematic. I also want to emphasize how bad the gaps are in regulation. We regulate 128 chemicals. There's 16,000 chemicals used in plastic. We regulate 128 chemicals globally that are used in plastic. And again, it's 16,000 based on the Plastic Chem report. So we need a chemicals regulatory vehicle with plastics. Plastics are chemicals, period. They're polymers. They're based on monomer chemicals. Microplastics are different subsets of that plastic polymer. There's shorter chains than the original material. The OECD estimates that chemical production and consumption will be predominantly driven by low and middle income countries by 2030. It probably already has happened. And yet we have very few biomonitoring data in low and middle income countries. So if you're going to identify what the disease burden and costs are of current exposure in those countries, you need a better biomonitoring platform than what we have right now. The data are very sparse. And I would argue that from an ethical and right to know perspective, there are multiple reasons to require disclosure of ingredients and monitoring of human exposure, so we know what's going on. And my final point is just to talk about the need for science. There is a need for science. There's enough science to act, but there's science that we need to build, especially as the chemical industry brings in new chemicals. I'm all for simplification of plastic, by the way. But if we're not going to have that, we need an infrastructure to evaluate science in real time. And we're in many ways similar to a situation we had with carcinogens 60 years ago with EDCs. And we set up IARC back then, an independent entity to evaluate the laboratory and human evidence for effects of, in that case, carcinogens. And we could use the same approach for evaluating EDCs. So, and particularly chemicals used in plastic. So we need a global plastics treaty that reduces plastic production, recognizes hazards posed by recycling and the use of bioplastics, that considers hazard rather than risk, and expands biomonitoring globally. And ideally, we would put more science to the issue to completely understand the scope of the problem that we're facing. I'm really privileged to have the opportunity. I hope I haven't run over time. Looks like I've gone a few minutes over, and look forward to the questions in the chat and over the Zoom. Thank you.
Thank you very much, Leo. That was an excellent presentation, and we have many questions here. I'm eager to give them to you. Can you talk about the combination effects of all these chemicals and how the cost disease burden analysis can represent the mixtures?
So the reality, as I move to make sure I have enough power to finish this call, it's a complicated answer because of synergy and additivity. and potential competition, some of the chemicals we're talking about, if you were to add them up linearly, would not give the correct result. And the fact is, we don't have enough data to fully tease out the potential for those additive and synergistic effects. So it's likely that we're underestimating the bigger impact by simple addition. In all our models, by the way, we took great care to avoid double counting, partly for that reason. I hope that's helpful.
Okay, thank you. Industry has said time and time again that the idea of reducing plastic production is just simply not on the table. They say, no, we're not going to even begin to consider that. How do we get the message that the harm they are doing to human population everywhere is damaging by this attitude? How do we get to them?
We make sure that the plastics treaty has health as a core vision and principle. I remember in Dakar when the pre-meeting leading to INC1, the international first meeting of the negotiating committee, was going on, and health wasn't even mentioned. We've come a long way through 3 rounds of negotiations, and I think that we need to keep getting the message out there that the science is robust, not perfect, but robust, and supports protections for human health and not just ocean plastic. We need to start at the top of the funnel.
Okay, thank you for that. Then what are the viable substitutes for plastics, and particularly in terms of food packaging, loaf of bread, frozen vegetables, containers of yogurt? What are the alternatives really going to be out there for, given that people with impure water are told that they can't drink the water out of the river, and now they're being told they can't drink out of plastic water bottles. But there's no substitutes yet in place for that kind of thing. It's really essential. Some of these attributes of plastic give in terms of food and water, and the sending of food around the world. I mean, what are the alternatives? They're not showing up anytime soon. For me, there's been a freezing.
I'm so sorry about my technical difficulty. I don't know if you went to the next question, but I can answer it now if you can hear me.
Yes, we can hear you now. Thank
Oh,
you.
great. Apologies to everyone. So we need, glass and stainless steel are not used the way they should be. And there are other alternatives that need to be used maximally. Second, we need to consider the essentiality principle. When do we really need plastic? And when are we using optional as the assumption of easy here? And the fact is that we need to carefully consider the costs of using plastic in the first place, just from the perspective that we're probably adding costs to the system, and in some cases padding the wallets of companies that are making these plastic materials in the first place. That may actually be the main motive. Above all, may actually be not necessary. I mean, unnecessary. I think of the cucumber in the plastic wrap as a great example.
Yeah. So you're talking about system change then, in terms of taking on the issue of essential use. Or do we really need a plastic toy? Do we really need this kind of plastic covering on cauliflower? Do we really need certain kinds of clothing whose fibers are laced with EDC chemicals because they're partially plastic, essentially? So that we're talking about system change too, aren't we?
Absolutely. So the system is the solution.
I'm just going through these questions here. Please address the impact on health over the lifespan of synthetic play surfaces like plastic and rubberware waste. Over the past 10, 15 years, children have been literally growing up on plastic because of the proliferation of plastic fake grass and synthetic rubber, tire waste, play surfacing. They grow up surrounded by a cloud of toxin containing plastic and rubber dust.
It's a huge and under-recognized problem. I think part of the under recognition is based in the fact that the consequences of fixing it are going to be huge. And the fact is that we need to have a reckoning with this topic. At the very least, we need to stop routinely using chrome rubber and other materials as simple solutions. There was a time we didn't use rubber from tires as the play material for children, and the same goes for plastic there in toys. Now, on certain subsets, there's been progress. So the the Consumer Product Safety Commission banned multiple phthalates in toys. So there have been some openings for progress.
And thank you for this exceptional talk. This comes in from everybody's question. The first thing they see, they go, is how much they appreciate your talk. But the question is, it's hard to praise this enough that your presentation, the science and its gaps lead to clear conclusions. Do you think we need to emphasize hazard over risk more broadly in environmental health? Lately, this person's been working in East Palestine, and I think the same principle can help us as well.
I apologize that I do have an East Palestine slide usually in my talk, and it just did not. I think I just didn't have enough space in my deck and time to really dwell on it. Disasters, having studied 9/11 research, I think part of the 9/11 disaster is a plastic disaster because there were many plastic materials actively burned on that fateful day. Disasters are a great way to spread plastic chemicals. And we don't consider that as part of the life cycle.
Okay. Next question. I live in one of the most environmentally progressive counties in the U.S. This is Montgomery County in Maryland. And politicians simply do not want to talk about plastic prevention. They continue to tout great recycling statistics in our county. What can citizens do to help evolve this mentality? Because as you know, the industry is building recycling plants in the Southeast United States and Texas and around Louisiana very rapidly, and is supported by US EPA grants often.
Well, I think in as we go into the plastics treaty, we have to recognize that the US is a plastics producer. It's an oil and gas producer. So this is an uphill battle when we think about policy actions. But it's just we're seeing it through the lens of the global treaty. I hope that's helpful in terms of responding to it. I remain very hopeful because we have made so much progress, and that's partly through consumer action and attention to this issue. They don't like BPA and related chemicals in baby bottles and sippy cups, and that was banned quickly by the companies asking the FDA to ban it. So there are examples of hope that I think we need to dwell on and use to propel us forward.
And I think we talk about the bisphenols and regrettable substitution. I think regrettable is such a soft and ineffective adjective for this, because regrettable is what happens when you drop your car keys or down the garbage disposal when it's
Right.
on. Regrettable. What happens with chemicals, it's criminal substitution, is it not? How can we prevent these substitutions being worse?
I'm not a lawyer, so I won't say, and I'm not a criminal lawyer, so I will not say criminal, but we have seen over the years that toxic torts have been a way to facilitate action as well.
Do you know the status of the European Union's chemical strategy for sustainable proposal to ban thousands of chemicals? Do you know if that's moving forward given the elections coming up? And
what I know may be an underestimate, and especially compared with the people I see whose names are on the call, who may actually be better local experts than I. But what I've heard is that the election more or less has shut things down, and that we're really going to be looking for post-election activity, and hopefully, and that's where people need to vote, because that's where the coalition will be able to support and continue the agenda.
Okay. All right. I think we've got many questions, but many of them are slightly repetitive. Could you comment on the problem of microplastics in fabric and clothing, and is it getting into the water supply through laundry?
Yes, we don't know how much I mean, in preparation for this talk, I looked up how many papers had looked at microplastics and phthalates and leaching, for example. Only 62.
Mhm.
So this is a fairly new literature, even though the basic environmental chemistry has been well established.
Okay, I think we are, what about all the absorbed phthalates and other EDC absorption from personal care products? It seems to this person that could be even higher than what leaks into food and water from packaging and from plastics. Then, of course, whatever the exact source is all terrible and needs to stop.
We know that that's another important pathway for these chemical exposures. I mean, in our analysis, we really focused on the chemicals and their use in plastic, but many of those consumer products are plastic lacquers, for example. I mean, think about nail polish as an example. So much of it comes back to plastic.
Another question, yes. At the INC4, are you doing a side event, or are you doing anything that people could tune into or get a recording of at the INC4 itself?
There are multiple plans underway. There's at least, and I don't know the status, an event that the host country, Canada, is running on the 22nd that we hope to participate in. Not aware, the side events were very limited this round and not health focused.
It's unfortunate. There seems to be takes a lot of effort to remind the people, the government delegates, that this treaty has a lot to do with health.
Right.
And it's not just waste. It's a continuing message I think people keep having to hammer. And one more comment on the disposal of plastics and incineration, particularly with halogenated additives. You mentioned a little bit about incineration.
I mean, dioxins. I mean, we can go beyond dioxins to furans and other other byproducts. So now let's not forget the particulate matter that adds to the delivery system for those plastic chemicals.
Okay. All right. Well, thank you very much. You've done a great job, and I know that we've had quite many people that have joined in, and many people will be downloading the recording of this presentation. And I look forward to working with you at the INC 5 coming right up. And thanks a lot again.
Thank you, Cheryl. And Leo, thank you so much. That was a really excellent presentation, and we're very grateful for all the really important work that you're doing. So I will just wrap up with some really quick final announcements. A video recording will be available on Che's website soon, and you will all receive an email with a link to the video. We encourage you to support the work of any and all of the groups involved in the EDC Strategies Partnership. You'll find links to each group on Che's Partnerships page. If you appreciate these webinars, please consider a tax-deductible donation to Che and/or any of these partners. And we also invite you to join us for upcoming webinars. Please join us for endocrine disruptors and hormone levels during pregnancy on May 7th. I put that information into the chat a couple minutes ago. So with that, we'd like to thank you again for joining us today. And we also really appreciate all the excellent comments that you put into the chat and questions you put into the Q&A. I realize we didn't get to all of them, and we just really appreciate all of the thoughtfulness of the participants and all the work that all of you are doing. So thank you again, Leo, for taking time to talk with us about this important work. I know you're at a conference and you took time out of the conference, so we really appreciate that. Thanks to our EDC Strategies partners, and finally, thank you to Che Director Kristen Schaefer for all of her help behind the scenes.